our families for the holidays, the way we have done so for years and years, generations in fact. But we have come together as a Commonwealth and a nation to reinforce that the only way through this is with each other. Pennsylvanians have stepped up throughout our Commonwealth to do what is necessary and to do the right thing to protect each other. You are volunteering to help in your communities and finding innovative ways to support each other. And while these are challenging and uncertain times, I am certain of one thing. We will get through this because of each other, and we will be stronger for it. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. And please use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch surfaces. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come in contact with others. And remember, my mask protects you, and your mask protects me. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families, our communities, and our Commonwealth that we will recover together. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. Or please call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from WNEP-TV. Yesterday, Lehigh Valley Health Network cited a shortage of testing supplies as a main factor in its decision to administer COVID-19 to people most at risk from the virus, those over age 65 and people with underlying conditions. With testing being done sparingly, how will the number of positive cases be counted? More specifically, will you count people who are assumed to have the virus but aren't tested? And how will we know when it is safe to start lifting some or all of the restrictions in a particular area or in the entire state?
Well, thank you for those questions. So first, yes, we have had occasional shortages of the certain chemicals or reagents for tests. And so we will reach out to Lehigh Valley Health System and try to help them obtain the reagents that are necessary. We have tried to push out testing as far as possible in Pennsylvania, both through our laboratory, through the Pennsylvania Health Department in Exton, through laboratories at hospitals and health systems, and then also with their ability to send labs to commercial laboratories such as Quest and LabCorp. And then we have had 2 testing sites, mass testing sites. The first was in Philadelphia and the second in Montgomery County. The Philadelphia site has closed, and Philadelphia is working on other ways to make sure that testing is available. The Montgomery testing site actually will be moving, so it's closed temporarily, but will move to a new site and reopen. And then we're hoping to have another testing site in the Northeast. So we're really trying to expand testing as much as possible. In terms of the difference between confirmed cases and probable cases, so yes, we are starting to think about data in terms of confirmed cases where we have confirmed tests that are positive, but then close contacts of those, maybe people in the same household, et cetera, who then have symptoms of COVID-19, well, they're a probable case, and we are looking at that data. We're going to be looking at many different factors in terms of when we can reopen part of the state. And again, it's not going to be one grand opening. It's going to go in a progressive fashion as we look at the numbers of cases, the numbers of new cases, the percentage of cases that are done in a county or in a municipality that are positive, and all of those different factors in collaboration with people in the counties as we start to open things up. But we're not there yet. We have made progress, but we need to continue, especially right now, the mitigation efforts that the governor has put in place, and that includes the closure of the schools. That includes the closure of essential and non-life-sustaining businesses and the statewide stay-at-home orders. The best way that you can help yourself, your family, your community, and our Commonwealth right now, please stay home.
Thank you. We have another question from WNEP. You stated that overall, Pennsylvania still has enough beds and ventilators to treat COVID-19 patients. Can you highlight for the people in the Northeast and Central Pennsylvania how many ICU beds we have in the different areas and how many of those beds are already filled?
So thank you for that question. So I gave in this press conference some statewide data, and we do have county-specific data available on the new dashboard, which is available at our website at health.pa.gov. Actually, myself and Director Padfield of PEMA, as well as our staff at the Department of Health and PEMA have been looking at that data this morning. And right now in Philadelphia, in the collar counties of Philadelphia, in the southeast, the suburban counties, and in the northeast, we do have enough regular beds, and we have enough ICU beds, and we have enough ventilators. But we're watching that data very closely.
Our next question is from WBRE-TV. The station has been receiving several questions like this one. Now that there have been several hundred workers testing positive at the Cargill meat packing plant in Hazleton, which supplies our grocery stores with wrapped fresh meat, is it safe to eat meat purchased from grocery stores that were supplied by the Cargill meat processing plant? Can the coronavirus exist on meat that is frozen after purchase?
There's no evidence that coronavirus could survive that freezing process. I have regular conversations with Secretary Redding, the Department of Agriculture, and we have confidence in our food supply.
As a follow-up to that, is it safe to eat foods that have been processed at these places? Is the department looking into the processing packing plants as well, and at grocery stores?
So we are actually issuing guidance this weekend, certainly by Monday morning, about guidance for individuals in food processing plants as well as grocery stores, and really the whole food chain. And again, that's in collaboration with Secretary Redding of the Department of Agriculture. And as I stated, we have complete confidence in our food supply.
Thank you. This question is from KYW. Can you address the issue of social distancing on the street? Should people be crossing the street to avoid others? How do you navigate staying away from people outside in cities where there are a lot of people who live close together?
Well, it is more challenging to practice social distancing in cities that have a high population density, which is really why what we'd like you to do is to stay home, because that is the best way to protect yourself from being exposed to this dangerous virus, COVID-19. If you are out, then you really want to stay at least 6 feet apart from someone else. So that might mean stopping while the other person passes and staying 6 feet apart. Or I guess it could mean crossing the road, although please be careful that you don't get hit by a car. But I think I would practice many different ways for social distancing. But the best way to practice social distancing is please stay home.
This question is from Radio PA. What is your response to legislation from the House Republicans to reopen businesses in Pennsylvania, to prevent long-lasting economic harm?
Well, so the governor and the administration and the cabinet do understand the significant economic challenges that COVID-19 presents to the Commonwealth of Pennsylvania as well as the nation. But I want to emphasize, from a public health perspective, it has been absolutely critical that we have instituted these mitigation prevention factors, and that includes the school closure now for the rest of the year. That includes the closure of non-life-sustaining, non-essential businesses. Of course, people do need to get food. They need to get medicine. They might need to get food for their pet. But except for life-sustaining activities, especially now, please stay home. And so this is an integral part of our process, and in terms of protecting Pennsylvania from COVID-19. And so I understand the legislature's concern about the economy and the desire to stimulate the economy, but now is not the time. Now is the time for people to stay home and for those non-life-sustaining businesses to be closed. But that will not be forever. And we are actually working with the governor and the administration in terms of plans for when and how Pennsylvania will reopen. Again, it's going to need to happen in a progressive, iterative fashion as we watch the numbers of COVID-19. But now is not the time. We have been successful in terms of flattening the curve, but we are still having significant new numbers of COVID-19, and we have to protect the public health and save lives.
We have a question from the Altoona Mirror that might be just an elaboration on what you just talked about. Can you describe how things will eventually open back up and what will be the steps?
Mm-hmm. Well, so we're going to be watching many different factors to see when areas of Pennsylvania can open back up. We're going to be looking at the number of cases. We're going to be looking at the numbers of new cases. And then we also look at the percentage of lab results that are positive per capita. So how many new cases do we have in areas that have 1,000 citizens, and then what percentage of those tests that are being done are positive? And when we see that COVID-19 is going down, that the incidence is going down, the percentage of new cases is going down, and that there is much less community spread, then I think that's the time in certain areas of Pennsylvania to be able to lift the business ban and to allow people to go out. And then we're going to watch it really closely in those areas to make sure that there are no new spikes. And then we'll do that in a progressive way throughout the state, watching really carefully for new spikes, for new outbreaks of COVID-19. This has been described by Dr. Fauci and Dr. Birx nationally, and it's the way we will progress in Pennsylvania.
We have another question from KYW. What do you say to the few Philadelphia churches that are keeping their doors open, saying they want to cater to parishioners who don't have internet access to services? So I understand that people, especially during these troubled times, will turn to their faith and to their spirituality and religion at these difficult times. But it is dangerous to be out, especially in the southeast and the northeast, congregating with other people. That puts them at risk to spreading COVID-19 to themselves, to the other people in the church, and then potentially to their families. And so my recommendation is to do as much as possible to practice social distancing and to stay home and to celebrate the holidays with your close family that are in your household. This question is from WLVR. Can you give us an update on Pennsylvania's medical rationing guidelines, and when will the final plan be released?
So I wouldn't call it medical rationing. That's not the guidelines that the way I would describe them. But we are finishing up our what are called crisis or emergency standards of care, and those should be out later this weekend.
This question is from WJAC. What would you need to see in order to begin lifting some of the stay-at-home orders? And further, what would you need to see to lift the closure of non-life essential businesses, as well as for allowing bars, restaurants to allow having patrons eat inside?
So as I was saying before, there's a lot of different data that we'll be looking at in specific counties and even in specific municipalities. So that would be how many cases of COVID-19 do we have? That would mean how many new cases are we seeing, and also new cases per capita, meaning according to their population. And I was mentioning we want to look at the percentage of tests that are done in a day or in a specific time period, and what percentage of those tests are positive. That gives us an indication about how prominent COVID-19 is in that area. And when we're seeing all of those measures going down in a progressive way for a period of time, then we will start to lift the closure orders, all the time watching for any type of outbreak. And so that's the idea under the governor's leadership, of course, and his decisions about how we will proceed.
As a follow-up to that, we are seeing the daily numbers over the past few days not increasing quite as much as they did on the previous day. Can you explain what that means and how that weighs into the decisions?
Sure. So previously, as I've been describing, we were seeing an exponential rise of COVID-19. We were seeing a doubling of new cases approximately every 2 to 3 days. It was going up in really it's almost like a straight line. But through the mitigation efforts that the governor has put in place, those prevention efforts, and through the actions of citizens in Pennsylvania, we have been able to bend that curve to a sort of a more linear way. So instead of going straight up, it's kind of going that way. It is increasing. We are seeing new cases every day, but we're not seeing as many new cases as we had before. And so the tentative conclusion is that we have been able to bend that curve, and the goal is that as we reach the quote-unquote surge that's been talked about, that it'll be a wave of new cases that will come up and go down, but it won't be a tidal wave that would completely overwhelm our healthcare system. So the measures that we have put in place are working, and now is the time to continue those measures. Not to get rid of them, but to continue them until it is safe to open up again, as I've been describing, and that's what we plan to do.
We have a question from Fox Sports Williamsport about the surge. There is a report from a Harrisburg area medical professional that the surge in central PA is still weeks away. Do you concur? Well,
we have been looking at lots of different models. We have been looking at models from the University of Pittsburgh. We've been looking at models from Penn, mostly about Philadelphia. We've looked at models from the University of Washington, which is a national model, but it has state-specific modeling as well. And that's been referenced a lot by Dr. Fauci and Dr. Birx. And so it does seem to indicate that the quote-unquote surge is likely in the southeast and the northeast over the next week or more, but not in all areas of Pennsylvania. And so we're going to be watching for potential surges in other areas. So it's hard for me to say in several weeks, but I think it will be later, certainly in the west and possibly in south central Pennsylvania than it is in the east, where we're seeing probably the surge over the next week or more. But we're going to be watching the data. As Dr. Fauci has said, is that the data determines the timetable. The virus determines the timetable, not us. And so we're going to be watching conditions on the ground with our statistics every day.
This question is from WESA. Why were the larger test sites closed that you referred to? If these are the federal sites that were closed, what reason was given for closing them? Isn't it too soon to close sites when testing is already limited?
Mm-hmm. So there had been concerns that the federal government was going to close the sites, but through many actions, including our great federal legislators in those areas, our state representatives, our federal representatives and congresspeople, as well as our state senators, actually the federal government reversed its decision, and they are going to be able to keep sites open. Now, Philadelphia Philadelphia has decided that they don't need that mass testing site because they have many other sites associated with some pharmacies as well as hospitals and health systems, so it wasn't necessary to be able to continue to expand their testing. But in Montgomery County, the site will reopen. It's closed in its previous location, but it's going to reopen in a new location, and then we're looking at another site in the Northeast.
This question is from WGAL. What progress is there in testing for COVID-19 antibodies in patients who have tested positive? Is there a way for doctors to tell if those patients are immune?
So we are looking forward to the expansion of the antibody testing. So previously, all of our testing has been testing various types of nasal swabs for the presence of the virus itself. Antibody testing, or serology, is different. That doesn't test actually for whether you have the virus now. It tests for whether you had it in the past and whether you're immune to it. And I think that that's going to be really important in the future. Right now, there's only one test that has received FDA approval, and it's actually not really available. But we're hoping for availability in the next number of weeks, we're not sure exactly when, of either that test or other tests to be able to start that type of testing. I think it'll be really useful to test people whether they're immune to the virus for healthcare personnel or in long-term care living facilities, perhaps with some of the food workers that we've been discussing about. So it won't be widespread yet, although that's a goal for the future, but we want to do that targeted type of testing to see who's immune from the virus COVID-19. So we're looking forward to the introduction and then the spread of that over the next number of weeks or months.
This question is from Penn Capital Star. The schools are closed until June 4th. Is it a reasonable inference that the stay-at-home order will last at least that long?
Again, the virus determines the timetable. We don't determine the timetable, so it's impossible to give you a date. And I've described previously about the statistics that we would look at, the data that we would look at to make those determinations under the governor's leadership, and then how we might do that in a progressive way. But I can't tell you a date.
We have a follow-up question from WLVR about when the state may begin to reopen. Do you see a role for phone apps and tracking with technology as a key part to moving out of this crisis?
Yes, and I think that different type of phone apps and technology will be useful to be able to track. For instance, there are smart thermometers that can track people's temperatures, and there's other ways to track whether someone has symptoms or doesn't have symptoms. So we're starting to look at that technology now, and I think that will be helpful as we start to open up Pennsylvania, but continuing to track any potential outbreaks of the dangerous virus, COVID-19.
Thank you very much, Secretary. Those are all the questions we have today. We will be back with another briefing on Monday, but tomorrow we will post all of the data on health.pa.gov. Thank you.